They say it's the most wonderful time of the year, but for some people, the holidays can be depressing. Now, this isn't true just for adults. Depression can also happen in children and in teens. So, what can families do to help? Well, joining me now is Dr. Kamala Glenn Taylor, Director of Clinical Services at Brentwood Hospital here in Shreveport. So, thank you so much for joining us today. What are some of the things that can trigger depression in kids and teens, especially around the holidays?
Well, there are a number of factors. One of the first things that you want to think about is whether or not there's a genetic history. Is there a family history of depression? That makes it more likely for an individual to also manifest depression symptoms. Other things are stressful life events. There could be bullying. There could be environmental changes. There might be a parental separation or divorce. There might be the loss of a loved one. There's several factors that play into it. Also, you have children that struggle with chronic medical conditions, and that could be a factor that plays into whether or not the depression becomes a part of their story.
What are some of the signs that parents should be on the lookout for in their children?
So things like isolation. In younger children, it can be a little bit different from adolescents. So in younger children, you might see behavioral issues, you might see irritation, you might see anger, you might see disruptive behavior. You might also see things like isolation or, at its worst, probably self-harming behavior or manifesting or speaking about thoughts of hurting themselves or others. You may also see some of the telltale things that may be inclusive of other mental health conditions that they might be struggling with, anxiety, ADHD. If you have a child who's struggling with anxiety and those conditions, it might also be more likely that you'll notice some depressive symptoms as well.
How do you recognize some of the symptoms? How do you differentiate them from a child maybe just acting out and being a child, or it being true depression versus just an episode?
Well, one of the things that you want to keep in mind is what's the conversation that we're having around what you're seeing. Even if you're seeing disruptive behavior and you're not sure whether or not this could be a sign of depression, what's the conversation that's happening around this change in behavior? How are you creating a supportive environment and making sure that that child feels safe enough to maybe even have that discussion about what's happening, what's changed?
So conversation and discussion, that's a big part of it.
Absolutely. One of the things that's troublesome, especially for children and adolescents, is not being able to verbalize exactly what's happening with me. Maybe I don't have the words for it, especially if you're thinking about a small child. Maybe I can't articulate what it is that's going on with me without somebody giving me that space to have that conversation, to prompt me to say, hey, what's changed for you? What's happening for you? And how are you feeling about this?
That's so important. And I think that especially with the younger children, you know, having such a hard time verbalizing what's going on with them, and you're still trying to process what's happening to you.
Absolutely.
So being able to listen and you know, having somebody who can relate to you and can understand what you're going through. Well, what about for parents that are trying to say, okay, I've done everything that I can. I'm not sure, where do I go from here? I've helped as much as I can, but I'm still feeling overwhelmed. What do I do now?
Well, for a parent who's in that position, it is imperative to seek the help of mental health professionals. That could look like seeking an individual therapist. That might look like at higher levels if you're noticing things like thoughts of self-harm. That might mean that you'll need for your child to be assessed at a hospital to determine whether or not they need that higher level of care, or if they'd be better suited for a lower level of care like an outpatient clinic, a partial hospitalization program, or individual therapy. A caveat I'll add to that is the idea that don't wait. One of the things that we want to keep in mind is therapy is not necessarily something that we have to wait for a crisis to utilize. If you think about a primary care provider, we don't just go there when we have a crisis, we go for regular checkups. So normalize those conversations about having therapy as we adjust to life in general.
That's great advice, and I'm so glad that you said that. Well, thank you so much for being here with us today and giving us all this helpful advice about depression in children and teens. And actually, this is just the first part of our discussion, so we plan to revisit tomorrow and offer some insight about depression in adults and senior citizens. So stay with us for that as well.